So good afternoon, everyone, or whatever time of day you're watching this, if you're watching on the replay on our YouTube channel. So I'm Esther Apasides of Thriving Communities. We're not-for-profit business where we really want to roll out happiness and well-being throughout the communities we serve. We are in many different areas at the moment. We're growing rapidly. And obviously, we've got a very wonderful team of volunteers to support us in this. And one of our key pillars is the Binder Body Wellness Programme, which is led by Dr. Mami Kaur, who you will see here on the participants list. And under this, we do these series of live health talks, and we're really, really grateful once more to the team at EPP from GAVO. So it's the Education for Patients Programme. Is that correct? Yeah, and it's basically people who talk from their own real experiences and want to share their own healing journey sometimes, or just what insights they've gained from being on something similar, in terms of the training and the learning. And so Helen Griffiths is our speaker today.
Hello.
We'd love to have her again. She is often joined by Amanda Scarf. Obviously, she's delivering some of her own training today. So thank you, Helen, for showing up today. We're going to be talking about understanding diabetes. So what is diabetes? I think we're talking principally about type 2, yes?
Yes, mainly,
Yeah,
yes.
yeah, no problem. And and basically also it gives her an opportunity to introduce the 6-week self-management program for people living with diabetes, and then also quick guidance tips really for people who need to look at for the foot care that's often an issue with diabetes. So thank you, and obviously at the end of the call, there'll be an opportunity to ask questions. So if you have any, you can unmute yourself and drop them in the chat, and we'll take them one at a time. So thank you very much, Helen, for joining us, and great to have you once more with us.
All right. Thank you, Esther. That's great. Yeah, as I say, I'm Helen. I actually live with type 1 diabetes, but I'm part of the education programs for patients, and I also deliver the diabetes courses. So what I'm going to do is talk first of all about what is diabetes. And this is one of the sections that we deliver in week 1 of our course, and it just gives you an overview of how diabetes works. All right, so our courses are actually scripted, so excuse me while I read from the script, okay, because they are nationally licensed courses. All right, so what is diabetes? Diabetes, sometimes there is confusion about the different types of diabetes and what diabetes actually does to our body. We start with the food that we eat. Much of the food that we eat is changed into glucose, which goes into our blood. And we need this glucose for energy. But before our body can use the glucose needs to enter our cells. However, glucose cannot enter a cell without the help of insulin. And insulin is a hormone which is produced in the pancreas, which is a small gland that's located below and behind the stomach. And this is what helps the cells to take up or absorb the glucose, sometimes called blood sugar, so that the body can use it as energy. So glucose fuels our bodies as much as petrol fuels a car. The petrol alone, though, is not enough to make the car run, as we know. We need a key to turn on the engine. And only when the car is on, when you've turned the key, can the petrol be used. Okay. So this is like our bodies. Glucose alone is not enough. We need a key that allows the glucose to enter the cells to produce the energy. And this key is insulin. Okay. So how does diabetes upset this? Because diabetes occurs when either we don't have enough insulin or the insulin we have doesn't work properly to let the glucose enter our cells. And this is known as insulin resistance. In both of these cases, glucose stays in our blood, and this results in high blood glucose, or as I said before, blood sugar sometimes called. So high blood glucose over time can cause high blood pressure, heart disease, kidney disease, and can lead to blindness and foot or leg amputations. So when we do our course, what we do, we give people the tools to help you to balance your blood glucose levels and manage your diabetes. There is also some of you might have heard of low blood glucose or hypoglycemia. And this can occur with people with diabetes if we don't have enough glucose in our blood. So low blood glucose can make you sometimes feel angry, or and it can even cause you to faint if it's very low. This is only likely if you have diabetes, and this is only likely to be the cause of your symptoms if you are taking insulin or sulfonylureas. I think that's how you pronounce it. For example, one of the medications taken is gliclazide, which might also cause this. So you might probably know there's two most common types of diabetes, and we're not going to go over these in detail. Just point out the most important differences between the two types of diabetes. So type 1 diabetes is insulin dependent. You need insulin to control this. And type 2 diabetes may need lifestyle changes and or oral medications, and you may need insulin as well. However, someone who has type 2 diabetes and requires insulin does not become a person with type 1 diabetes, but they still have type 2 diabetes requiring insulin. There's also another type of diabetes called gestational diabetes that develops in some women when they're pregnant. And I know my mum had this. And many times the diabetes will go away after pregnancy, but sometimes it doesn't. Women who develop gestational diabetes or who have any of the other types of diabetes and become pregnant need to work closely with their healthcare professional to ensure a healthy mother and baby. There is some evidence, though, that the chances of diabetes later in life can be increased if you've been diagnosed with gestational diabetes. And also, some people have been told that they've got pre-diabetes or borderline diabetes or are at risk of becoming diabetic. And if somebody has been told they have pre-diabetes or borderline diabetes, it means that your blood glucose levels, and that's measured by a test called HbA1c, your blood glucose levels are between 42 and 47 millimoles per mole. This is higher than normal, but not yet high enough to be diagnosed with type 2 diabetes. However, you are at higher risk of developing type 2 diabetes, and that you become type 2 diabetic when your blood glucose levels are above 48 millimoles per mole. So all of us who have pre-diabetes or diabetes need to manage our blood glucose. And if you do come into this category, caring for our diabetes can really seem overwhelming, especially at first. And that's why when we actually run the diabetes course, we learn the tools to become more involved in our care, better at understanding and managing our diabetes. So that's one of the sections that we sessions that we deliver during week 1. Okay. And as I said, I live with type 1 diabetes, so it's part of my everyday life. Okay. But our courses are all about self-management. So it's what we can do for ourselves, how we can manage our conditions at home when we don't have access to medical advice and guidance. And self-management, the principles are that we manage our condition, all right? So we manage our diet, our medication, our exercise, and if we have any symptoms, we manage those as well. We have to manage our daily activities and roles. So we've still got to carry on being an employee, maybe have a social life, a spouse, parent. Okay, so we look at how we can do that the best we can. And we have to manage our emotional well-being. So dealing with any emotions that we have, such as stress or anger and frustration that come with a condition. The tutors who deliver the course, there's always two of us that deliver this course, and we're not medical professionals, okay? So we don't answer medical questions, all right? But we live with or are affected by diabetes. So we can give examples of our personal experience and give guidelines, but we don't give any medication advice or medical advice. So I'm just going to have a look at the course content because it's run over 6 weeks, and just tell you a little bit about some of the things that we cover. We look at how to monitor your blood glucose, how to make your blood glucose levels go down if need be and go up if need be, okay, and how to balance it. We talk a lot about healthy eating, and we've got a menu planning sheet where you can work out how many portions you have and what the guidelines are for the portions each meal, but generally each day. We do some menu planning, and we talk a lot about food. We talk about the fat and the carbohydrate, and we also talk about dealing with low mood and depression. We talk about dealing with stress, because it's all part of the condition, about managing ourselves. We look at communication skills. We look at Footcare and how to prepare for sick days when you're not feeling very well. And we also do an action plan each week. So each session that we create an action plan for ourselves, something to make ourselves feel better. All right, and it does help when you manage your conditions. If you can just do one little thing at a time, rather than try and tackle everything together, it makes that progress much easier. Okay, and we always make sure that whatever you plan to do is absolutely achievable. Otherwise, we don't want to set anyone up to fail. So there's a lot on there. We talk about what we can do to help delay or prevent complications. We talk a little bit about complications, because that's the whole thing that we're trying to avoid with diabetes, is for that continued high blood glucose levels to damage our body. So there's a lot about what we can do to manage our blood glucose, because it's not just food. People think it's just food that affects our blood glucose, but it isn't. It's mainly the carbohydrate content of our food that affects our blood glucose, but also exercise can affect your blood glucose, stress, being ill. Okay, there's change of temperature sometimes as well, that can make a difference. And I went away to a very hot place. It was very nice, and all of a sudden my need for insulin dropped. So you have to about being aware of your body and what's happening, and learning to understand how your body reacts to in different situations. So there's quite a lot on that. We talk as well about exercise and how much exercise is good, and how to monitor your exercise, and putting all our food choices together. We also talk about dealing with your healthcare team, because when you've got something like diabetes, we can't rely on the doctors and healthcare professionals to solve it, to do everything for us. It's our body. We have to do it up. We have to manage ourselves. So we have to learn as much as we can about the condition and work with them, because it's a partnership. We have to tell them what's going on, and then they can help to give us good advice. But it's a lot about the partnership with our healthcare team, but we don't see very often, especially now, even less so than we used to. But it is important to sort of know as much as we can. So we also have a separate session, which is a single one, which is about diabetes foot care. because you might have heard that I said one of the things that we're trying to avoid is foot or toe amputation. Okay, because the blood, there's high level of glucose in the blood, it can affect our feet especially. So we talk about what we can do to look after our feet. Things like, how to cut our toenails. Be careful that you don't have any sharp objects. Wearing the right kind of footwear so you're not rubbing your feet and creating any problems. And in this session as well, we've got some lovely pictures of really nasty looking, as we say, traumas and problems with the feet. So you need to be, need to be aware of that if you're going to come on, if you would like to join that course. So, as I said, I've been living with diabetes a long time, and it does affect my daily life. And I'm lucky because I am used to it, and I've grown comfortable with it now over time. It's been a long time I'm doing it. But when you are living with diabetes, you have to make decisions dependent on your blood glucose level very often. So, for example, because I'm on insulin, or I'm on and anyone on a medication that can cause low blood sugar, you need to take your blood glucose levels before you drive and think, can I drive? Or do I need to take some extra sugar? Or so I have to do that. Very often I've been late to things because I can't actually drive at that time because I'm in either having a hypoglycemic attack or at risk of it. But they also my diabetes, I've got to be aware of it when I choose what to eat and how much to eat. When I'm doing exercise, how much exercise I do. And I've got to remember to take my medications and also to have my medications with me at all times. So there is quite a lot to think about when you have diabetes. And one thing with diabetes, it can be easy to ignore because you don't necessarily get pain. You don't necessarily get symptoms when your blood glucose is too high. You might feel, oh, I'm fine. But it's just remembering that you've got to look after yourself to avoid as much as you can any long-term complications from high blood glucose. All right, I don't think I've talked for that long actually, but I seem to be a bit fed up with my own voice. Is there any questions that anyone would like to ask?
I think it's not for me personally. My husband is type 2 diabetic, as I mentioned before we went live. So is there any point at any time where he can sort of make a decision or consult with the doctor to say, is the medication that I'm on necessary? Can I gradually wean myself off? Is there such a thing as weaning off a medication for type 2 diabetes? Or is it something that's not advised? I don't know. So it's like, I suppose it's seek your advice, isn't it, from the GP? I don't know.
Obviously that's a medical decision, but I do
Yeah.
know that with type 2 diabetes, in some cases, it is possible to reduce your blood glucose levels.
Mm.
And I have to tell you, my husband was told he was pre-diabetic, and he's lived with me. Well, he knows. He said, if I become diabetic, you're going to make my life hell. So he actually went on a diet, cut down a lot of his carbs, lost some weight, and he's no longer pre-diabetic. So he has managed to bring it down.
Mm.
So if you can bring it down, then you do get out of that danger range of being diabetic. So yes, with type 2, I don't think it's necessarily possible with everyone because everyone's different and there can be other factors involved.
Yeah, sure.
But yes, yeah.
Yeah. Is it mainly diet, or can it be stress related? Can that bring that diabetes on? Or is it mainly to do with your lifestyle and your eating habits more?
I think it's probably a combination of factors. I know that with type 2 that eating the wrong things is always bad for you anyway, isn't it?
Mm.
Or too much of the wrong things, should we say? Because I have to be honest, I'm not perfect. I can't say I never eat things I shouldn't because, that's life. You've got to have treats, haven't you? But no, I think it's because, as I said, stress can make your blood glucose levels go up. But I'm not sure if they've ever actually found out what the actual cause of diabetes is. And I know as type 1, there is no clear-cut cause, you know. So, yeah, but a healthy lifestyle will help. That's all.
Yeah. So obviously that's focusing a lot on the nutrition, the diet, and then the exercise side of things, and yeah, managing that. Yeah, lovely. Thank you. Anybody else for any questions?
Where is the course? It's not for myself. I don't suffer from diabetes, but I just wondered where you say the 6-week course.
Right. At the moment, we're doing our courses online via Zoom like this.
Oh, right. Okay.
So anyone in, and we actually operate throughout Gwent.
Right.
So anyone who wants to come on the course can come on a session like this via Zoom.
Right.
This means you've got to have Zoom and an email.
Yeah.
And,
yeah.
Just log
I'd have
on.
to check with him. It's my brother-in-law, so I'd have to check. Yeah.
Yeah. Okay. But,
Thank you.
Helen, how often do these courses run? Is there one about to run, or is it running at the moment?
We've got one about to run, is starting this Wednesday, but that's pretty full. But I've got quite a lot of interest in one later in the summer that will run on a Monday morning.
All right.
From about 10:15.
Mm-hmm.
So that's likely to be around September. So if anybody is interested, just you can email epp@gavo.org.uk. Or go onto the GAVO website, and we have an EPP page there where you can read the course.
Okay. For those not in the know, GAVO stands for Gwent Association of Voluntary Organisations.
That's right.
So,
thank you.
Because I know not everybody knows that. But,
yeah.
But it's obviously it's government supported, government funded, isn't it?
Yeah. Oh, okay.
Yeah,
thank you.
Yeah, there's no charge for the course, and anyone can refer themselves on. You don't need to go through a medical professional.
Okay. All right. Okay. Thank you.
And each session is how long?
Each session is between 2 and 2.5 hours.
Okay.
And you sat at a computer, but we have a little break in the middle. And if anybody wants to get up and walk around, or we don't tie you to the computer, obviously. And the courses are interactive as well. I just read that bit to you, but a lot of them are, it's a lot. You are included, you are asked questions.
She's gone now.
No,
she got her answers. So yeah, maybe she had to get away. Mamit, have you anything to ask or say, contribute?
No, I think whatever you said, it's quite in a very simple language for the patients to understand, and it's quite useful. I was just thinking, once this talk is recorded, at least I can direct my patients to listen to you, and obviously the surveys, what's available in the community to improve their diabetes. At least something is there in place, where they can access. So that's quite useful. Thank you so much.
Yeah, we can do if people can't commit to a 6-week course. I've had a couple of inquiries for a single session as well, where we do a little introduction to it. So we can run that as well if we get the demand for that, and that could be online as well.
Okay. Yeah. So just to recap, what was the email to reach out on? I'll make a note of it so I can put it in the show notes on YouTube so people can
EPP.
Yeah.
GAVO, GAVO.
Yeah.
.org.
Okay.
.uk.
Yeah. Yeah. Okay. Lovely. epp@gavo.org.uk. Fantastic. Yeah.
Helen, you're okay if someone writes an email or contact you on the email? What you share?
Yes. That email will go to Manda and myself.
Yeah. Okay. So one of you will answer. Yeah.
Yeah.
No, that's quite useful, and and it's a very simple talk, and it's not a long talk. So I'm sure people would appreciate that.
Yeah. We're very grateful because EPP, that I think Manda, we had to talk before on fibromyalgia. So there's other courses that you run that might be of interest as well. So I'll pop those in the show notes. I think there's nothing changed since the last time you did a talk for us. So unless you want to, yeah. And so I'll make sure
What
that
are the
that's
other
also in there.
courses do you run, Helen, or what are the popular ones? Yeah.
Well, the most popular one is living with long-term pain.
Oh, the long-term pain one. Yes, you did that one as well, the pain management one.
Pain
Yeah.
management. And there's also a one that's just generally living with long-term conditions. So anybody who has any sort of condition,
Yeah.
it gives you the same principles of action planning and being, positive, dealing with emotions, problem solving.
Yeah.
Yeah.
Lovely. Okay. That's wonderful. Well, thank you very much, Helen, for joining us today and sharing your insights and knowledge on, how to manage and look after yourself if you've been diagnosed with diabetes type 2 specifically, and how to deal with foot care as well. Just a little bit of a the connection, why that happens, why we got problems with the feet. So yeah, I think it's been really enlightening and really helpful, and hopefully those viewers that watch it on the replay will also hopefully reach out if they need help and support from yourselves. Yeah,
it's good to hear that you can offer like one-to-one introductory session if someone is newly diagnosed and feeling
well, it's not one-to-one, it's one session. So it would be a group of so it would just be an introduction. So that we normally have between 6 and 15 people, but tends to be some lower numbers.
Smaller.
So
Yeah.
It's quite a nice group size. And thanks very much for inviting me.
Thank you, Helen. Much appreciated, and enjoy the rest of your day.
And you.
Thank you. Bye-bye.
Bye.
Bye. Thank you.